Yes, my name is Donna, and I'm here actually to talk to you about women and cardiovascular disease. And when I said I'd speak about something, it's a big decision to go, well, what is most relevant, or what do I think might be most relevant to the women who are coming here? And there's so many different things in our lives that are important at different times. So I thought I would actually talk about cardiovascular disease. Some of you may know a little bit about cardiovascular disease and some of you might know quite a lot, but I think it's really important to reflect on ourselves and our journey with cardiovascular disease and across our life too. We're often caring for other people, family members and friends, and we don't always get that opportunity to reflect and think about our health as well. So I'll talk a bit about what cardiovascular disease is, about the risk factors, focusing really on what we can change, and give you some information about those risk factors and guidelines, and also talk a bit about motivation, because motivation is really the key to many things in life. Thanks, Jess. So just a few bit of information about here, basically, that cardiovascular disease is really a collective term essentially related to diseases of the heart and blood vessels. It doesn't have everything up here, but some of the more common words that you might know or conditions you might know, obviously stroke arrhythmias, which are irregular heart beats, heart valve problems and stenosis, heart attack, angina, peripheral vascular disease, so a whole range of different things that essentially they relate to blood vessel disease. So we get what's called atherosclerosis over our life, and that's basically a build-up of sort of plaque in our blood vessels that then ends up contributing to these diseases. So I was reflecting myself and thinking, well, why talk about it? And one of the main things I think is that really that it's looking at heart disease, it's actually the single biggest killer of Australian women. It's also true of Australian men, so it's not just women who get heart disease, obviously men as well. And interestingly, 3 times as many women die of heart disease compared with breast cancer each year. Heart disease is responsible for 1 in 8 premature deaths in women. And I think the key thing that got me thinking about it is that I actually read earlier, or at the end of last month actually, a media release from the Heart Foundation, which actually had Shepparton marked as number 19 across Australia in relation to heart-related hospital admissions. And we do hear in the media a lot about Shepparton and cardiovascular disease and obesity, diabetes, all those things. So that's what got me thinking about that all. I think there was one more before that, we've skipped one.
I don't know if I can go back. I didn't mean to do that.
That's all right. So it was just a quote, that's all right, Joyce. It was just a quote that said that research tells us that more than 40% of women will not experience chest pain. Will not experience chest pain if they're having a heart attack. And I think that's a really a key thing amongst women. Obviously, men do slightly have increased chances of having heart attacks and strokes, but women don't tend to pick up on the symptoms so much. So the outcomes for women are often worse. So that's really important to remember. And in your show bags, there is a piece of paper, and if there's nothing more that you do tonight is really to have a bit of a look, and I don't have time to go through all the signs and symptoms. It looks like this, and to have a bit of a look through and looking at the warning signs of heart attack, and also what to do if you were thinking maybe you were having a heart attack. Chest pain and discomfort is actually the most common symptom for men and women, but women are actually more likely to report things like shortness of breath, back or jaw pain, and nausea and vomiting. So they don't often pick up on the signs that they might be having a heart attack. So that's really important to remember, so that you're picking that up and seeking early treatment. So now we talk about prevention. So we're thinking about prevention. First of all, let's look at what we can't change. So our family history, things that we were born with, our ethnicity and increasing age. Age is our biggest risk factor with all of these things. So keeping that in mind, those things that we can't change. Looking at what we can change, and you sometimes hear these called modifiable, and they're all lifestyle factors generally. Okay, so they're things that we can actually try and do from day to day to improve our life. So I'm just going to quickly touch base on all of them. We get all these different guidelines of what we should and shouldn't be doing. This is actually just about providing information to you about what our current guidelines are from our Australian government. And as women, we're caring for so many people, like I mentioned before. It's us who then can take that information on board and then sit back and reflect and look at our life and go, well, is there anything that I can do to help make me healthier? So when we're talking about smoking, smoking rates in Victoria are at about 13% now. They were in 1985 at about 35%. So smoking rates have dramatically decreased, but we still have over 700,000 Victorians who are smoking. So there's still plenty of work to be doing, and often it's people from lower socioeconomic groups or different groups that really sometimes need support to help quit smoking. I always try and suggest to people that getting support to quit smoking greatly increases your chance of giving up, and the slogan that Quit have is never give up giving up. So even if people have had a go at quitting smoking, to have another go at it because they learn about their own behaviour when they have a go at quitting. And also too, if we have people around us who are smoking, not telling people that they have to quit smoking is actually asking, can I help you quit smoking in any way? Can I support you to make better choices? So when we're talking about physical activity, we hear about lots of information about how sedentary we are, that we're sitting a lot more, and there's lots of evidence and media, lots of information in the media about it. But generally it's really moderate physical activity, about 30 minutes of moderate physical activity, aiming for that every day of the week. And when you talk to lots of people, people aren't doing nearly that amount of exercise. And some people are doing a lot more, but it's really getting moving as much as we can. And that might be just parking further away, and might be just little incidental activity that we can do by taking the stairs or walking to the shops, and making different choices like that to be a bit more physically active. So when we're talking about overweight and obesity, Olga touched on BMI. BMI and waist measurement is generally what we're being asked to try and use as a guide to see whether people are in the overweight or obese range. It's just a guide and it's different for everyone, so it does give a really good base point for us if someone was trying to make some changes. But I think that it's important to remember that if someone is overweight or obese, that if they could be trying to lose a little bit of weight and lose 5 to 10% of your actual or current weight, that can give you really great benefits for your cardiovascular wise, but also across all of your health too. So sometimes, it's not ideal to be just aiming for particular areas. It's making any reductions is also great. Harmful use of alcohol. So really just remembering that for healthy men and women, no more than 2 standard drinks on any day is the guidelines at the moment, and remembering we often fill our glass up a bit too much too, and it might be 2 standard drinks that we're having. And also depression and lack of social support and connections can contribute to cardiovascular disease. And it's just interesting to talk about depression in women, and there's many reasons across our life that we could have depression, and 1 in 5 women will have depression at some stage of their life versus 1 in 8 men. So it's certainly a common thing that we do see. And many reasons why women might suffer from depression might be that there's significant changes in living arrangements, might be violence, abuse or eating disorders, pregnancy, motherhood. The list goes on of the reasons why that we might actually start feeling depressed. And Beyond Blue is a really great resource and website that you can jump on, and there's actually got a link on there that you can actually do a bit of a self-assessment, where you can actually click on there and do an assessment and see whether you might be feeling a bit depressed. We know that if we've got good social support and connections, that can help reduce it. So, and today is our Are You OK Day, so it's a good opportunity to remember to be asking your friends and family, is everyone feeling okay, given that suicide is quite high in Australia as well. Stress. So the big key thing, motivation to change. So The important thing to remember is that health behaviour change is very individual. We're all different, and what motivates one person isn't going to motivate another person, and that doesn't matter because we are all different. So I just want to challenge everyone and just get you to have a bit of a think about, is there anything that you think that you could make in relation to sort of any change that you feel like you could make? Or is there any way that you could improve your health? And most of the time people can say yes to that. Not always, but sometimes there's little things that you can go, okay, well I could improve this. And what is your motivation to change, or what could be your motivation to change? Your motivation is different for everyone, like I mentioned. It might be that it's your family, it's your friends, or living a longer, healthier life. It's certainly different for everyone. What motivates you, I suppose, to get out of bed and go to work and run around after children or run around after family? And thinking about your health changes, where do you see yourself in 5 years, 5 to 10 years, and does getting cardiovascular disease fit into this plan? So thinking about how important our health is. So the good news is it's never too late to get started. So really thinking about what you do for you. As women, we're caregivers, like I've mentioned before. We do so many things for other people. So firstly, you need to look after yourself by taking time out and doing things that you enjoy. Women feel selfish when they go, oh, I'm going away, I'm doing this, or I'm doing this for myself. So really using that as an opportunity. It's not being selfish, it's actually looking after yourself, looking after your mental health, looking after your physical health as well, and looking for something that you enjoy. Some healthy changes, I suppose, when you're doing things for yourself and then you're thinking and reflecting about how you might start to be a bit healthier. It doesn't have to be a big change, it could be just something that's very small, and you can maintain that change and go, well, that gives me the confidence to actually then have a go at something else. It might be that you skip meals, or it might be that you always park close to the supermarket and you start parking a little bit further away. So it could be anything that's small that then you go, gee, I've been able to do that and I've implemented that in my life and I've been able to stick with that, and then you might have the confidence to try something else. So whatever it is that you might be thinking that you could sit down and have a think about changing or working towards being healthier, I suppose it's important to remember that having support from family and friends, health professionals, if you're needing it for sort of quitting smoking, those sorts of things, that actually can help you maintain changes. So having support is really important. Joining a group, we're really lucky in Shepparton. I mean, we have lots of gyms and things, and gyms aren't for everyone, but we've got great walking paths, we've got great services at different places across the community, like Primary Care Connect or the Hub in Marootna that have strength training or walking groups and things. So if that's for someone, people can get involved in those as well. So that's really important that as a community we use each other's resources to help make our community healthier. If you make a bit of a change, even if it's a small change, being proud of yourself for making the change is really important, and going, good on me, I've been able to do this and I can stick with it, because we are really often critical, and we are critical of ourselves. So Olga was talking about before in the Women's Health Check, we can talk about your cardiovascular disease risk, and this is basically a snapshot of the calculator and some of the information that we put in: sex, age, blood pressure, cholesterol, those sorts of things. And we really can just come up with a number essentially, but it puts you in a category as to what your risk of having a heart attack or stroke, or getting heart attack or stroke in the next 5 years is. So it's just a great resource to be able to use. In your show bags there is a stroke card, and there's a little booklet as well, a cardiovascular disease risk booklet that you can have a look through. And that's about it. So, and also this one, this is the Oz risk score, again, that Olga talked about. This is actually looking at our diabetes risk. We know that diabetes is on the rise. very fast across Australia and across the world. And so this is something that you can do yourself. It's on the Diabetes Australia website, or we can do it here as well in your check. But it's really opening that discussion about how do we aim to prevent diabetes. So the other thing I'd like you just to remember too, and think about when you are seeing your GP and having your blood pressure and your cholesterol and those types of things checked, rather than just going, oh, is it okay, and say, oh yes, it's fine. Know actually what your numbers are, know what your blood pressure is, know what your cholesterol is, know what the results are, so that you actually then can make sort of informed choices about, okay, well, I'm happy with it sitting here, or I'd like to sort of get another opinion, or I'd like to see, make some changes, but you know actually what your results are. So it's important to know what they are, because we know that those things, cholesterols and our weight and blood pressure, as they change, they're early indicators to us that cardiovascular disease is starting, and we need to be able to manage it and stay well.